Friends, I am Dr. Surajit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 10 homeopathic remedies for dyspepsia. What is dyspepsia or indigestion? Dyspepsia presents often as a sign symptoms of special diseases like ulcers, gall-bladder disease, GERD is gastroesophageal reflux diseases, etc. Again, it may present itself as a functional disorder where there is no organic change, but just an error of peristalsis in upper digestive tract or an error of feeling of the patient creates a type of chronic ailments like non-ulcer dyspepsia, pseudo-ulcer syndrome, gastritis, nervous dyspepsia, pyloro-duodenal irritability, etc. So, the diseases may be organic, functional, and many times it may be a error of feeling also. Now, note this figure. Stomach has got two sets of fingers, sphincter or valve. This is called lower esophageal sphincter, and this is pyloric sphincter. Esophageal sphincter, pyloric sphincter. These two sphincter works in a very concerted manner. When the food is coming from esophagus and it is just accumulating in the stomach, it is locked. When it is almost filled up, then it opens and the food goes back into the pyloric part, I mean the first part of the intestine. Now here, what happens? It is blocked. It is in the receiving stage, but meanwhile, while it should be open, it is not open, it is blocked, and the food content or fluid, food fluid, etc., it is going back into the esophagus. This is called esophageal reflex. And you can ask how it is. It is due to irregular activity of the sphincters. That is a disease actually, disease condition. What are the symptoms or signs of dyspepsia and how many persons suffer from dyspepsia? Symptoms are sensation of burning, pain, uneasiness in stomach and upper gastric tract. Sensation of bloating due to accumulation of urine in gaster and upper gastric tract. Belching, nausea, vomiting, sour feeling near throat with burning, heaviness in the head or headache. 20% people of the world suffer from dyspepsia and 80% of it are functional disorder. Functional disorder means these are not originating from some serious organic disease. It is due to malfunctioning of the system. The pictures, just note the pictures. Who are at risk for dyspepsia? Following are the risk factors. Number 1, history of alcoholism or other addictions. Number 2, history of consuming stomach irritating drugs like aspirin and other painkillers over a long period. Number 3, presence of abnormality like ulcers, etc. in the gastric tract. Number 4, suffering of anxiety, depression over a long period. Number 5, habit of taking food and drinks fast. Number 6, habit of taking huge amount of foods at a time. Number 7, habit of taking caffeine-rich drinks too much. Number 8, habit of lying down just after taking foods. How to prevent dyspepsia? I have written nothing because prevention is the just opposite of this thing. Either you control this or do not do this. That will be prevention. That is, don't take alcohol too much or other addiction too much. Don't consume stomach irritating food, drugs like aspirin too much. Try to avoid anxiety, depressions. This should be avoided by taking regular exercises or some asanas, etc. You can take this. Just try to do break these things. So that will be preventing the dyspepsia. I have given a few things. That is various types of addictions. This is stomach irritating foods. This is stomach ulcers, anxiety, depressions. What are causes of dyspepsia? Number 1, gastric ulcer. Number 2, GERD, gastroesophageal reflux disease. Gastroparesis. Gastroparesis means actually the stomach is partly paralyzed as it found in diabetic condition. Stomach infection, irritable bowel syndrome, chronic pancreatitis, thyroid disease, pregnancy, gastric cancer. Some are light, some are very grave, such for example gastric cancer. Very problematic. Chronic pancreatitis, a lot of person is to die in this particular disease. And relevant pictures have been given here. Just try to correlate these things. Esophageal sphincters, this is esophageal sphincters or esophageal sphincter. This is pyloric sphincters. This is IBS. IBS is irritable bowel syndrome. The whole bowel is in irritable stage. When to call a doctor? Number 1, in case of blood vomiting or there is coffee ground substance in the vomitus. Coffee ground substance in the vomitus, loss of appetite for days after days, weight loss without any reason. In case of tarry stool, blood in stool. If there is excruciating pains in abdomen, uneasiness in stomach over a long period, hard lump is felt near stomach, very often it is a symptom of cancerous stage. If there is all pervading weakness and tiredness. Arsenic alba for dyspepsia. Burning pain with great sensitiveness of the pit of the stomach. So sensitive that it cannot be touched. Pit of the stomach will be clarified later on. Frequent vomiting of ingesta which excoriates the throat. Red irritated tongue which feels hot as if scalded. Worse from cold drinks, better from warm drinks. Sensation of emptiness of stomach, still they do not feel like eating. Saliceva dyspepsia, age-old dyspepsia with activity, with acidity, heartburn or chill sensation. Canine hunger, wants to eat just after eating. Limbs tremble if food is not given. Again, anorexia may be there. Subject's desire for raw foods and veggies instead of cooked foods. Just look the peculiarity. Patient doesn't want ready food. He wants raw fruits, veggies. Like beer, but not fish meat, which do not agree to. Intense heartburn, sensation of a load in epigastrium, throbbing at the pit of stomach. Now, these particular two terms, pit of the stomach, epigastrium, here also pit of the stomach. First, note the epigastrium. The whole abdomen has been divided in clinical medicine in 9 parts. The 9 parts, first, second, third. This is the first 3 part, second 3, last 3. Hypogastrium, epigastrium. Note, this is hypogastrium, epigastrium, hypogastrium. There is right hypogastrium, epigastrium around just above the navel, just below the pit of the stomach. Here lies the pit of the stomach. This is the pit of the stomach. Here lies the pit of the stomach. Below it, epigastrium. Left hypogastrium. Umbilical region. This is umbilical region. This is left lumbar. This is right lumbar. This is right iliac. This is hypogastric region. This is left iliac. This 9 quadrant abdomen has been divided by medicine specialist into 9 compartments for discussion. And epigastrium is just at the end of the sternum, and above the epigastrium region lies the pit of the stomach. Paraphosphor dyspepsia, undigested food particles in vomitus or stool, is one of the keynote signs of this remedy. Anorexia, aversion to milk, worse from meat and sour things, vomiting just after eating, vomitus so sour that it sets teeth on edge, hammering pain in forehead, temple, chronic diarrhea or costiveness, sleep restless and dreamy, great prostration in the morning. With indigestion, there is fever, redness of face, intense thought. This remedy never fails. Mind this total line underlined. Aversion to meat, milk, desire, sour things. Calcareous phosphodyspepsia. Pain in stomach starts just after intake of food. Body getting thin to thinner day by day. Infants like to nurse always and vomit milk easily. Craving for raw, salty, piquant foods. Ham, salted, smoked meat. Desire for tobacco smoke, which lessen headache. Subject's problems seem to increase when thinking of the disease. Undernoted, underlined, and it is written USP. This USP is not this USP on the used in the market. This USP, homeopathic USP, means these symptoms is U means uncommon, S means strange, P means peculiar. Uncommon, strange, peculiar symptoms. Subject's problems seem to increase when thinking of the disease. This uncommon, strange, peculiar symptom ranked class 1 in the evaluation. That is, from this one single symptom you can take a particular medicine. So powerful is this. Lycopodium clavatum for dyspepsia. Intestinal flatulent dyspepsia from heavy farinaceous food or from vegetables. Farinaceous food actually is the foods which are mainly composed of starch and various starchy food, and vegetables. Constant sleepiness, but sleep not refreshing. Desire for food. Desire for food, but a little food satisfied appetite. Empty sour eructation with sour taste of everything, even sweets. Rise up to the pharynx, burn there for hours. That is burning near the throat. Worse from cold drinks, better from warm drinks. Incarcerated flatus. That is, flatus means wind actually. That is blocked. This wind is not going up, not going down, causing bloating with shooting pain across the right to left. Worse from 4 to 8 p.m. Cannot tolerate tight clothing over hypogastrium. Palpitation during digestion, sensitiveness to gastric region of gastric region to pressure only after meal. Subjects like sweets, delicacies, pastry, hot food, drinks suffer from liver and urinary affections. Salicylic acid for dyspepsia, flatulent dyspepsia with extreme distension of stomach after eating with putrid flatus. With putrid flatus with temporary relief. That is, when putrid flatus is emitted, there is temporary relief. Vomiting characterized by same putrid fermentation, great irritability with despondency, anemia and severe weakness. Creosotum for dyspepsia. Deep and lasting disgust for foods and drinks in convalescence from severe diseases. For least quantity of food and drinks fatigue them equally. Then after several hours, food is thrown up undigested. Great and constant nausea with inclination to vomit, but without actual disease. Trouble, listen. There is no disease symptoms is there. No true disease is there, but fully functional. Cold feeling in the epigastrium internally. Epigastrium has already been explained. As if cold water ice was there. Tension over stomach area. Cannot bear tight clothing. Water taste is bitter. Worse from cold, better from warm drinks. Weary from slight exertion, better after sleeping. Caliphos for dyspepsia. Dyspepsia due to nervous debility or too much of mental exertion. Unnatural appetite, always feeling hungry, but little food satisfied hunger, again sometimes no appetite at all. Wind accumulates, abdomen gets distended, palpitations. After food, burning near throat, pain about stomach, nausea. Vomitus contains bitter tasted undigested food, sometimes blood, belching and farting of fetid wind which give them relief. After food, drowsiness, craving for sweets, cold and sour drinks. Hydrochloric acid for dyspepsia. Pain starts after 2-3 hours of eating above navel with sensitivity. Burning pain extending upward to esophagus. Appetite lost. Colicky attack, white coated tongue, picture 1. Vomiting mainly in evening, at night of bile and ingesta. Ingesta means actually food. Subjects get emaciated, dyspepsia resulting from some chronic inflammation of stomach or bowels like IBS, irritable bowel syndrome, Crohn's disease or ulcerative colitis. Some serious disease. These are organic diseases. Hydastis canadensis can, short can, Hydastis canadensis, that is can for dyspepsia. Atonic dyspepsia. Atonic dyspepsia means when the viscera or the organs of the body lost its tone. That is, here the gastric tract, including stomach, intestines, have lost their tone. show dyspepsia result. It is a grave disease. Cancerous diathesis. That is for patient of cancerous diathesis, high diathesis is very important. Empty, aching, gun feeling in stomach, worse vomiting, large, flabby, slimy tongue. Picture 2. Large, flabby, slimy tongue. Sour eructation, placing hand lightly on the pit of stomach already explained, reveals pulsation. Fainting from exhaustion. Pyrosis. Pyrosis is actually alternative to heartburn. Burning pains in umbilicus with stitches in epigastrium extending to testicles, appearing after stool. These symptoms appearing after stool with great weakness. Now, one special information is given. Please note this. To know more about the homeopathic therapeutics of dyspepsia, please consult Homeopathic Therapeutics by Dr. S. Lilienthal. Dr. Samuel Lilienthal's written this book, Homeopathic Therapeutics, is the most exhaustive, authentic, and final book in the world. It is available on the internet also, possibly some PDF format. You please try. That is the most exhaustive book. With this, the video ends. Thanks for listening, viewing. If you feel any difficulty, please write down in the comment section. I will certainly reply.